Have you ever wondered, when can I stop having colonoscopies? For many, colonoscopies are a necessary but dreaded part of maintaining health, especially as we age. They're a critical tool for preventing colon cancer by identifying and removing polyps long before they become dangerous. But as with any medical procedure, there comes a time when the risks and benefits need to be re-evaluated. In today's video, we'll dive deep into the purpose of colonoscopies, when and why they might no longer be necessary, and the key factors that influence this decision. Whether you're considering your next colonoscopy or helping an aging loved one navigate their health decisions, this guide will help you make an informed choice. Stay tuned, because we'll also discuss the role of polyps, risk factors, and the importance of personalized healthcare in determining when to stop. Colonoscopies are one of the most effective tools we have for preventing colon cancer. Unlike diagnostic tests that detect disease after it's developed, a colonoscopy is proactive. It identifies and removes precancerous growths called polyps. Polyps are abnormal growths that develop on the lining of the colon or rectum. While not all polyps become cancerous, some can grow and transform into colon cancer over time. Removing polyps significantly reduces your risk of colon cancer. Think of it like weeding a garden. By removing small weeds before they grow out of control, you're maintaining a healthy environment. The timeline of polyp growth. One common question is, how long does it take for a polyp to become cancerous? While the exact timeline varies, research suggests that it often takes at least 10 years for a polyp to transform into cancer. This slow progression provides a window of opportunity to intervene through regular screenings. The role of your first colonoscopy. The first colonoscopy, typically recommended at age 45 for average-risk individuals, is particularly important. It provides a baseline view of your colon health. If polyps are found and removed, it essentially gives you a fresh start. However, this doesn't mean you're done with colonoscopies forever. New polyps can develop, and follow-up screenings ensure that any new growths are detected and addressed early. Surveillance colonoscopies. What are they? After your initial colonoscopy, follow-ups, known as surveillance colonoscopies, are scheduled based on your individual risk factors. These procedures focus on monitoring and removing any new polyps that may have formed. How often are they needed? The frequency of surveillance colonoscopies depends on what was found during previous procedures. If no polyps were found, you may not need another colonoscopy for 10 years. If 1 or 2 small polyps were found, follow-up may be recommended in 5 to 7 years. If multiple or high-risk polyps were found, you might need a repeat colonoscopy in 1 to 3 years. Why would you stop having colonoscopies? At some point, the risks and benefits of continuing colonoscopies change. Let's explore the key reasons why you might stop having colonoscopies. 1. Age and risk factors. Guidelines generally recommend stopping routine colonoscopies around age 75 for average-risk individuals who have never had polyps. By this age, if no polyps have been found, the likelihood of developing high-risk polyps is very low. 2. Health and longevity. Your overall health plays a significant role in this decision. If you're healthy, active, and have a family history of longevity, continuing colonoscopies beyond age 75 might make sense. Conversely, if you have serious health conditions that shorten your life expectancy, the risks of the procedure might outweigh the potential benefits. 3. Diminishing returns. For individuals in their 80s or beyond, the likelihood of benefiting from another colonoscopy decreases. At this stage, most polyps that might be found are likely to grow so slowly that they wouldn't cause problems within a person's remaining lifespan. Balancing risks and benefits. While colonoscopies are generally safe, they're not without risks, especially for older adults. Understanding these risks is key to making an informed decision. Potential risks of colonoscopy include complications from sedation. Older adults may be more sensitive to anesthesia, increasing the risk of adverse effects. Bleeding can occur when removing large polyps, which may require additional treatment. There's also the risk of perforation of the colon, a serious complication that involves a tear in the colon wall, although this is rare. These risks must be weighed against the potential benefits, particularly in individuals with significant comorbidities like heart disease, advanced diabetes, or severe respiratory conditions. How to decide when to stop. Making the decision to stop colonoscopies should involve a thoughtful discussion between you and your doctor. Here are 3 key factors to consider. 1. Your overall health. Are you in good health and free from major chronic conditions? Do you have a family history of longevity? If yes, continuing screenings may be worthwhile. 2. Your colonoscopy history. Have you had multiple colonoscopies without finding polyps? Were any polyps found small and low risk? If you've consistently had clean results, you're likely at low risk for future colon cancer. 3. Your personal risk factors. Do you have a family history of colon cancer? Have previous colonoscopies identified high-risk polyps? Individuals with high-risk features may benefit from continued surveillance even past age 75. Special considerations for high-risk individuals. If you've had high-risk polyps removed in the past, your doctor may recommend continuing colonoscopies longer than average-risk individuals. High-risk polyps include large polyps, greater than 1 centimeter, polyps with precancerous features, and multiple polyps found during a single procedure. For these patients, continued surveillance ensures that new polyps are detected and removed before they pose a threat. What if you're unsure? If you're on the fence about whether to continue colonoscopies, consider these scenarios. Scenario 1. You're 75, healthy, and had no polyps. In this case, guidelines suggest that further colonoscopies are likely unnecessary. Your colon has proven to be low risk for developing cancer. Scenario 2. You're 75 with a history of high-risk polyps. Here, the decision depends on your overall health and willingness to undergo further screenings. If you're in good health and have a long life expectancy, continuing colonoscopies may be advisable. Scenario 3. You're 80 with multiple chronic conditions. For individuals with severe health conditions, the risks of colonoscopy often outweigh the benefits. In this case, your doctor may recommend stopping surveillance. Family history plays a significant role in determining colon cancer risk. If a close relative like a parent, sibling, or child has had colon cancer or high-risk polyps, your risk increases. So what should you do? Start screening earlier, typically at age 40 or 10 years before the youngest case in your family, and continue surveillance longer, even into your 80s if your health allows. Understanding the numbers. Statistics can provide perspective when weighing your options. About 5% of people will develop colon cancer in their lifetime. This means 95% of people won't. If you've had multiple clean colonoscopies, your risk is likely much lower than 5%. Tips for reducing colon cancer risk. Even if you're no longer undergoing regular colonoscopies, you can take proactive steps to maintain colon health. 1. Eat a fiber-rich diet. Fiber promotes healthy digestion and reduces the risk of polyps. Focus on whole grains, fruits, vegetables, and legumes. 2. Limit red and processed meats. High consumption of red and processed meats has been linked to an increased risk of colon cancer. 3. Stay active. Regular exercise supports overall health and reduces cancer risk. 4. Avoid smoking and excessive alcohol. Both habits are associated with an increased risk of colon cancer. 5. Monitor symptoms. Be vigilant about symptoms like changes in bowel habits, unexplained weight loss, or blood in the stool, and report them to your doctor immediately. The emotional side of stopping colonoscopies. For some, the decision to stop colonoscopies can feel unsettling, as if it signals the end of proactive care. It's important to remember that this decision doesn't mean giving up. It means focusing on the most beneficial and least invasive approaches to maintaining your health. Colonoscopies are an invaluable tool for preventing colon cancer, but they aren't necessary forever. Knowing when to stop involves a careful balance of risks, benefits, and personal health factors. If you or a loved one is navigating this decision, consult with a healthcare provider who understands your history and can provide personalized guidance. If you found this video helpful, please like, share, and subscribe to our channel. Your support helps us continue creating valuable content to empower your health journey. Thank you for watching, and may you stay healthy and informed.